Hey, welcome back to the show. On this episode, I have Jayodita Sanghvi, who is the Senior Director of Data Science at Included Health.
Hi, thank you for having me. I'm excited about this.
Well, on this show, we always love the journey that you've been on to get to where you are. So, could you just give us a quick rundown of how you got to where you are today?
Yeah, of course. Today I lead data science at a company called Included Health, where we try to hold our members' hands through the healthcare system, really helping them with every part of their journey, from their logistical needs through their clinical needs, helping them get to the highest possible quality of care, and we also deliver care ourselves. In a nutshell, the idea is better outcomes for our members, lower healthcare costs, a much better healthcare experience, really just improving the standard of healthcare for everyone. Um, I've been at the company for about 9.5 years. Prior to being at Included Health, I was an academic. So I did my PhD and postdoc in computational simulations of living systems. Basically worked on building the first computer model of a cell that included every single gene function and molecular interaction. Definitely a mouthful, but I enjoyed the work. But what was getting to me at that moment in time was the path to turn that theoretical work into realized impact. I think in that academic route, it would have taken me decades, if ever, to really get to that point, and that's why I had gotten into the field in the first place. So I heard about this company, Included Health, and it just seemed like a great opportunity to use a lot of that same statistical modeling skill set that I had built up, but now towards that realized impact. And that part has totally played out to be true. So we get to hear stories from our members all day long about how we've really been able to help their journeys. And I can do the trace back and say, hey, here's where data fits into all these stories. And that's my fuel. That's why I have been at the company for so long. And that's why I keep doing what I do.
That's amazing. I often hear that it's that people from academia they love what they do there, but it ends up being too maybe theoretical and less
Mhm.
applied. And at some point, if you want to have real world impact,
Yeah.
you could take all of that knowledge that you acquired on the research side in academia and then start applying it in the real world. And it's really interesting because I think that's where a lot of friction happens potentially, which is real world scenarios might not be as clean and easy to work with as you would in academia
Mhm.
potentially, and then you have to kind of do really difficult trade-offs to kind of make that happen, right? So,
Mhm.
and I think turning to that, obviously, now the healthcare system can be very confusing and overwhelming for a lot of people. I'm wondering how Included Health is using AI and data science to guide members through their healthcare journey and ensure that they receive the highest quality care possible.
Yeah. Um, Maybe an analogy here is do you use the Starbucks app?
I have used it. Yes.
Mhm.
Yeah.
If you think about the Starbucks app, which I do think is awesome, when you log on, it kind of knows what your favorite drinks are. When there are new drinks that kind of pop up, it has recommendations of what you might like. When I travel, it kind of knows where I am and it routes me to the right Starbucks. Um, and everything's just easy, right? I pick up my phone, I know exactly how much it's going to cost, and done. Right? That's
Mhm.
kind of the angle that we're trying to bring to healthcare. Maybe easy to accomplish with your grande latte, but now let's kind of bring this problem over to the healthcare system. Um, I think that there's a power of AI and what it can do to make healthcare much more understandable, much more easy. It can actually get people to the right providers within the system that actually have the right experience to treat this member of this community at this moment of need, and the power to just kind of integrate across the whole system such that the member experiences one experience, one seamless kind of interaction with the system without having to worry about the seams. So, how Included Health kind of helps across that whole journey is in all of those different touch points, starting with the logistical needs and making that seamless for the member, then moving
Mhm.
on to routing members to the highest quality of care, and then ultimately delivering care, but in a way where it is information complete, and our providers have kind of the whole story behind the members and are really able to help them through their entire journey in a way that seems very connected.
Incredible. I'm very curious, I guess, really digging into that a little bit. How do
Mhm.
you really get the data that you need from
Yeah.
the different entities that you need it from? Because that's been the biggest challenge in the healthcare system, at least compared to, let's say, financial services, where maybe the data is more readily available. In healthcare, it's all segmented, fragmented, and of course, you have PHI. So there's regulatory reasons to be really protective of how that data is used.
Yeah. Excellent question. Let me start off with the what data do we use? It's actually a number of things. And I think a power of kind of how we're able to bring our insights to life is in the combination of a number of different sources of information. So we use kind of national databases of billing data that cover kind of a good volume of the providers and patient interactions in the United States. This particular data set is fantastic because it gives us good coverage on kind of the provider population in the United States, and helps us build models that help us discern what their differences are in their experiences, kind of where their different safety profiles are, kind of how they have differential experience in treating different types of populations of patients, kind of what makes each provider different, and in particular, what makes certain providers really good at what they do. The second set of data that we use comes from our own clients and really covers kind of that billing history and past of the members whose lives we cover ourselves. The awesome thing about this data set is it gives us that richness again in the members whose lives that we're kind of helping through their healthcare journeys. From this, we're able to understand what matters to them, where their histories are, what their needs are, what their preferences are. And then this allows us to turn it into a matching problem where we can say, hey, this provider or this benefit is most appropriate for this member at this time. And we can actually guide them through their journey. The third and maybe most exciting data set is what the members themselves are telling us, right?
Mhm.
So we learn from everything. We learn from how they click on our app. We learn from what they're typing in search boxes, what they're just directly telling us. We send them surveys asking for kind of how they're feeling and how many healthy days they've had in the past month. And this is where they're directly telling us what they need of the system, what's not working for them in the system, and ultimately the most powerful tool that we have to make sure we're getting what's right for the members. You're
That's incredible. I think,
Mhm.
yeah, that's a data set that a lot of people don't turn to, which is data that the patients themselves are offering up, and then user behavior specifically within the app. Right, it's something you
Exactly.
see, for example, in consumer applications all the time. You don't
Mhm.
typically see that in the healthcare system, and I think that analogy to the Starbucks app is great because of that. You
Mhm.
understand user behavior deeply, so you have the
Mhm.
relevant recommendations to them. Um,
Mhm.
so, in terms of delivering better patient outcomes, I could see that the analysis on the providers could be deeply meaningful to that audience
Mhm.
because they know which providers to turn to given a particular condition, right?
Exactly.
So,
Mhm.
I think that that's deeply meaningful. Could you maybe highlight a few more things that the data aggregation analysis would do in terms of a better patient experience in the app itself?
Yeah, absolutely. Um, so maybe another example that I can pose is today the healthcare system really requires you to navigate yourself through the system. So,
Mhm.
kind of during my first pregnancy, for example, I had to go figure out what OB I wanted to see. I had to make sure that that OB got my records. I had to make sure that my prescriptions were sent to the pharmacy for me. I had to make sure that I was registered at the hospital. I had a moment in time where I had to correct the provider and say, hey, that's actually not my record that you're reading off of, that's another patient's. Um, I had to make sure that I was connected to a pediatrician, etc. Right?
Mhm.
Instead, there's a world in which kind of you pull this out of your pocket, and there's just so much that you can do kind of in one place right here. Right? I
Mhm.
can go in and I can kind of type in what matters to me. Where I have easy questions about the system, there are automated ways in which kind of I can have a chat-based experience where those answers kind of come back to me in an accurate way. When I need providers to kind of and care professionals to come in and out. They kind of weave seamlessly in and out. And I don't have to retype in my information. It's just right there. They can see it. When I need to kind of get in-person
Hmm.
care and move out of the system into kind of into other providers or other healthcare benefits, I can easily schedule, I can easily connect, and everybody can kind of see the same information and interact with me as if, instead of me having to orchestrate like everything that has to come into play, the system orchestrates for me. And I think that's like what makes all the difference.
Yeah, it makes sense. Instead of you
Mhm.
having to kind of pull information, do your own search um,
Mhm.
to navigate your own healthcare journey, more of it gets pushed and it's enabled through the data plus analytics engine that sits on top. And it's great that it's a mobile first experience, right? Which I think
Mhm.
modern user experiences, modern like users expect modern user experiences. I think in the healthcare
Mhm.
space, maybe that's lacking, but I think you've been able to kind of get inroads into that.
Yeah.
I'm very curious, given all this data that you have and the mobile app, what are newer applications like Gen AI able to power that, let's say 2, 3 years ago, maybe you weren't quite able to do within the mobile app itself?
Exactly. So I think that's a great segue from that vision, which I just kind of posed to you.
Hmm.
I think Gen AI really helps with a lot of the tidbits within there. So first is kind of let's make the logistical hurdles of healthcare just insanely simple, right? There's no reason why we can't kind of have that information at our fingertips and have kind of a more automated chat-based experience to get the simple questions answered and quickly. Second, um, I think that AI, and actually we've been in the business of this for a number of years, well before the hype that is today's
Yeah.
generative AI world. I think AI has done um, a lot in helping us again discern the differences in that provider population and really connect what type of kind of patient provider interactions lead to the highest possible clinical outcomes, and then use that as our north star of how we route members to the highest quality of care for their needs at the right moments in time.
Hmm.
Lastly, I mean, healthcare is a soup of information, and it's both hard for the member and also hard for the providers. And in both of those, being able to kind of pull the most important tidbits out, explain it in the context that each party actually needs for what they're trying to achieve in the system is something that generative AI can really help with. On the provider side, here's a snapshot of all the important things that you need to know about the member in a digestible way that you can just absorb it in 30 seconds. For the
Hmm.
member, even after a visit, maybe I didn't get all my questions answered. Maybe there are words in there that I didn't understand. Maybe there were side effects that I don't remember. Well, I can have almost like a continued interaction beyond just my 15-minute visit where I can continue to dive deep and like unpack the information that I need at the pace that I need. Um, so I think that the opportunities of how we can apply AI and are applying AI in
Hmm.
the healthcare space are really boundless.
Yeah. That makes sense. Once you have the data in a format that is more readily accessible, if you layer
Mhm.
Gen AI on top of it, you get really novel user experiences, maybe more conversational experiences. So anything that you weren't able to ask of your provider, all that data that sits behind it that was generated during the visits and diagnoses and such is captured. So you're able to go and query against that. I think the problem that we've seen, and we do a lot of workflow automation in regulated industries, is how do
Mhm.
you get a large language model aligned on the relevant context that the model needs to be able to answer a question? Because the last thing that we want, and we see this as well, because just a lot of users out there, they even query like an OpenAI model for medical advice, right? And sometimes
Mhm.
it's good, sometimes it's not good, but there's no way of really assuring
Mhm.
that their answers are grounded for that particular individual. And so that alignment problem is a huge problem that we see in the healthcare space. I'm curious
Absolutely.
how you've been able to start tackling some of that.
Yeah, it's a great question, and I think that we have kind of a few solutions through it. I think that the first is that we really don't see ourselves in the business of replacing a clinician or their judgment, right? I think that in a future world, it's going to be a kind of human kind of centered, AI empowered world where it is really going to be that balance of both coming together that ultimately build the experience for the member. And so I think that that kind of that oversight of the highly trained professional is extremely important through all of this work. Um,
Mhm.
that comes all the way through to the validation of our models. We do a lot of kind of human based validation of kind of all of the results that are coming out of the various models that we build, be it on the logistical side and kind of as we move forward in time, anywhere that we kind of move onto kind of clinical support as well. Um, and then lastly, I think that it's also about the way you build the nuts and bolts of the experience in itself. Always having, for example, ways to kind of exit out, let's say, of an automatic chat-based experience into a human interaction, et cetera, where there's kind of this notion of there's a limitation of what the automated experience can do, and certain things are going to be more complicated, certain things are going to have more nuance, and you need that ability to toggle back and forth between the different modalities of getting the information that you need and the care that you need.
Yeah, I love that. I mean, I think that handoff between AI and a human and back and forth is so critical
Mhm.
because then you use AI where it's good and capable, and then where it can't, where it runs
Mhm.
into a dead end, the provider comes in, right? So it's really enabling people in this case to be able to handle more volume and deliver better experiences because they're backed up a little bit by AI, right? It acts as an assistant and enabler to
Mhm.
what they already do. But it's not replacing the provider. It's really
Yeah,
enhancing them to actually have
exactly.
a better, larger, more positive impact.
To add to that, I also think an interesting place where AI is going to come into place is in that decision switch. I think we've seen kind of promising results of being able to build out the models that can determine, hey, is this inquiry something that the AI can handle, or is this something that we do need to route to a human, or even through the conversation, oh, now this has gotten more complex, let's route this to the human. So I do think that decision switch is also an interesting place where the generative AI comes in.
Mm-hmm. So I think what you've laid out is a really incredible experience for patients. But how do you get the other parties to play along, the providers, the insurers, others who are involved in the overall system?
Great question. I think that the incentives in the healthcare system have often been misaligned or very financially driven, which honestly has led to some of the slower progress of the technological inflections in this space. I think there's a few areas in which you kind of can see misalignment. Maybe I can talk through a couple. The
Mm-hmm.
first is we partner with large employers who are typically self-insured and kind of allow them to bring the included health services into their benefits package. One thing that's really helped us align incentives with the employers, who of course are also cost conscious through this, is that through our operations, we have found that that we're able to improve the quality of care while also bringing down the cost of care.
Mm-hmm.
And I don't know if I would have believed it until I actually saw it, but this is super important for making the model work. If you want to wrap your head around it, think of us getting a member to the right provider for them earlier on in time. So you
Yeah.
remove a lot of the runaround in the diagnosis phase. Then you also remove a lot of the unnecessary tests and labs. But more importantly, this high quality provider is getting our members onto that right treatment path. So over time, you see fewer complications, fewer hospitalizations, fewer readmissions, less ER visits. And so that's where you get this reduction in cost. That's the flywheel that helps our particular model keep going because obviously the employers want lower costs, but a really
Mm-hmm.
productive employee base who's happy with their healthcare experience. The employees want the same thing for themselves and for their family members. They want to be as healthy as possible, but they also want as low out of pocket fees. Right. And
Yeah.
so by aligning those incentives, we're kind of really able to grow our business and help the members.
Mm-hmm.
Um, Another area in which incentives are often misaligned is in the financial aspects of how care is paid for. And largely today in the US healthcare system, we are a fee for service type of system where the payment comes from the volume of care that is delivered. That is not always aligned with kind of the best kind of clinical outcome for a member, where you're not really wanting to control the volumes that are of activities that are done or not done in the healthcare system. Instead, you'd want to optimize for just what the ultimate outcome is for the member. And this is where you kind of see funny patterns happen in the healthcare system. Like it's hard for doctors to collaborate with each other, or you do see kind of payers trying to reduce the utilization of certain types of services,
Mhm.
et cetera. This is definitely much more of a vision, but over time, we're really interested in how we can turn more and more of the system into a value based format,
Yeah.
where at least our providers and all of our partners are really incentivized around kind of what is that ultimate quality of care that we are delivering for the member, and how can we create the right incentives through the system to make sure we really get there. And I think the trick for us and how we will be able to get there is in our notion of really understanding that clinical quality, and kind of we can do that optimization of making sure we get the exact right patients to the right professionals, who can actually deliver those highest outcomes at the lowest costs, and again keep that flywheel running.
I love that because I think you've highlighted some of the misalignment of incentives that you see that make it hard to get really great outcomes in this space. And I think that patients and employers want similar things. They want low cost, great results as quickly as possible because they want to remain functional. There is a little bit of friction between the payers and the providers, because one's trying to minimize the outgoing payments, the other one's trying to maximize it.
Right.
But ultimately, if we can make it value based, then all of a sudden it's maybe the incentives are a little bit more aligned, right? So obviously, included health is very savvy with the way it uses data, to the point where you can do very clever things like apply Gen AI for conversational experiences and have different recommendation systems to match providers and patients. Um, for the rest of the healthcare space that maybe hasn't gone through maybe even the data journey that they need to go through, what are some recommendations you have for those institutions that ultimately want to get their data in order to be at a place where they can even think about applying things like Gen AI?
Mhm. That's a great question. And I think that, first of all, we just are seeing a lot of progress in the space, as a few things are kind of coming together. Electronic health record systems are becoming more and more prevalent over kind of older methods of paper records. There's also been recent regulation changes which help the exchange of such information happen much more easily. There have also been kind of advances in data interoperability, and frameworks such as the FIRE framework that allow data to kind of have compatible data models and be used together more seamlessly. Um, and so I do think that year over year, the amount of data that we have access to and the ability for that data to talk to each other is getting better and better. I think the last hurdle that remains is that these things still sit in very, very separate systems, and the systems themselves are not built to talk to each other. Um, at Included Health, we like to say integration is the innovation.
Mm.
And that's something that we've been working a lot on, right? How do we break the walls between the different systems, even within Included Health and with our partners in the entire healthcare ecosystem, such that that data can more freely move kind of between each part. And it doesn't feel like you're interacting with 17 separate systems, but rather having one single healthcare experience.
I love that. That line is so critical. Integration is
Mhm.
innovation, right?
Mhm.
Because you have EHR systems, so you have digital records now more so than ever before. Sharing is becoming more permissive, as you said, because of regulations and such. But
Mhm.
there are integrations among even a large like healthcare provider that may have merged and acquired businesses, and you have kind of discrete systems that need to be interoperable. That's hard. And then sharing it in a way that can be used readily downstream is difficult as well. Um, so have you gone through that journey in included health? So you work with many providers. There's lots and lots of data. I imagine a huge part of this is the data engineering exercise to do this well. Can you talk a little bit about how you've been able to navigate that journey over the last 9 years or so?
Yeah. So you're absolutely right. It has been a journey. And something that we realized really early on is something that we really need to invest in and do a good job at. So I think we've just built up a really incredible team of kind of data scientists and data engineers, infrastructure engineers, et cetera, who've kind of put in the time to build the right systems to bring in data, model the data properly, and consistently. Um, we kind of build up our own standards of how we want to exchange data within our own ecosystem, and kind of set forth the narrative of how that data exchange ought to happen, and make it easy for our partners as well to exchange data. Um, we've also spent a considerable amount of time working on our security and privacy, and we hold an incredibly high bar on how data is stored, used, and accessed across our systems and by our personnel. Um, and all of this has taken up time to build. But I think
Yeah.
that I'm really proud of the place we've gotten to, because it makes all the difference in being able to be able to use the data and get the right insights from it.
I'm curious, as the head of data science at Included Health, what are some of those challenges that you faced when working with healthcare data? You've mentioned privacy concerns and data quality issues that could arise. What were some of the solutions that you had to incorporate in order to overcome those challenges?
Mhm. So absolutely. So data security and privacy is paramount at Included Health, or any time that you're using anyone's healthcare data. We spent a lot of time just figuring out how it is going to be stored and locked down. Um, any data used for analytical purposes is always anonymized at the company, and we're really strict about kind of when it would ever move out of that environment, if ever. And so I think it's been really a process of having a really high bar on ourselves around the rigor of what we allow ourselves to do, and just never sacrificing on that. We've got to dot all the I's, cross all the T's, on kind of any type of data or software that we're using. Make sure things are secure before we can proceed. A second challenge in the data space is data quality.
Mhm.
And I mean, this would stem from any type of data that we use. Maybe an interesting example is network data from insurance companies. This is really important data for us because as we're guiding members through the system, we want to make sure that we are sending them to in network providers, and, of course, have the right information about those providers in terms of phone numbers, address, specialty, etc. The CMC recently found that about 40% of data that you find on the insurance carriers' websites has an erroneous address or phone number. So, even from kind of the source, it is really hard to get high data quality. Some of the tricks that we've put in place to get around this include, again, using a collection of data sources and building probabilistic models that allow us to kind of find those areas where there are the most discrepancies between data sources, and then
Yeah.
pinpoint, like, hey, those are the areas where we would have the least confidence in this being accurate. We also have manual approaches, like calling those areas of low confidence to double verify the information that we have on those locations, and
Mhm.
even extending it into our product itself, where there's low confidence, mentioning to the member, hey, there's low confidence here, you might want to call this facility and check before you go.
Yeah.
Yeah.
I think a lot of those data challenges seem quite daunting,
Mhm.
because I could just imagine if the data is wrong at the source,
Mhm.
identifying that there are some anomalies there, maybe
Mhm.
when you cross-reference other types of data that you have for a particular individual or from a particular
Mhm.
provider, and then being able to remedy. I mean, these are pretty arduous tasks, which in a data-first company might be able to do. But
Mhm.
I'm curious, what is your recommendation for providers and healthcare people in the healthcare industry that have been around for decades, that they've amassed a lot of different data streams over time, and now they're having to really modernize their data side um, of that business. Is the answer basically growing out a homegrown team to do that, or are there maybe good software providers that they could use to speed up their journey there?
Yeah, I think the space is really evolving, and you're seeing a lot of kind of newcomers come into the space. I do think that even starting from the electronic record companies, um, to kind of various point solutions, there are external solutions now that are trying to kind of organize the data, clean up the data, provide data security solutions,
Hmm.
help with data interoperability, help with data summarization, visualization, etc. So I do think that the number of options out there is improving, and I think the art of it is going to be kind of how you use all of this together, and ultimately, again, the system feels like one and not just not disjointed.
Yeah, yeah, I completely get that. I think one of the things that multimodal we've noticed is that a lot of established businesses have pre-existing process, and the process works for the most part. They have people, point solutions. They really cobble it together to deliver like really the core business. The challenge is, how do you go and replace certain portions of that process with point solutions that may make sense? And then the most important thing is that integration piece, right? And like you said earlier, integration is the innovation, right? That middleware layer that ties
Mhm.
people and process and point solutions that are brought on. So it's all of a seamless experience. The data flows the way it should. And then if that's done well, then you can bring on new parts of the stack entirely, like Gen AI, to go and deliver new experiences. But that middleware layer, I think, is also really critical. It's point solutions, middleware layer, and then ultimately building it for your pre-existing people and process, right? So it's not like gutting and replacing wholesale things that have been working for your business at large.
Yeah.
And it's really interesting because the innovation happens incrementally, but
Mhm.
because the base is so large and volume activity is so large, there's pretty substantial impact, right?
Absolutely.
And I think that's where the real opportunity in healthcare is innovating from within as much as possible.
Mhm.
So looking ahead, what are some of the most exciting or transformative applications of AI that you anticipate in the next, 3, 5, 10 years from now?
Yeah. Honestly, my dream and hope for the healthcare system is that kind of in that timeline, the healthcare system's just going to know me, right? Instead of myself having to have a PhD in the understanding about the nuts and bolts of a healthcare system, which really is what it feels like today. Um, I think that the power of AI is going to enable kind of that personalized touch through the experience. It's going to enable us to really deeply understand each individual, what their clinical needs are, what their demographic needs are, if they have any care gaps, or kind of access to care gaps, what they just value. And again, instead of the member having to know, here are my 50 different options, here are my, options provided by my health insurance, here are my options provided by my employer, here's how much this is going to cost, here's how much that's going to cost. Instead, they will just have a path laid out for them. Here's a much more simplified view of kind of the maybe one or two best next actions that each member should take, and also this explanation of, here's why these are the right things for you, in words that resonate with you, in words that you understand.
Mhm.
So instead of it being a confusing kind of system that people try to avoid and kind of dread, you kind of feel
Mhm.
empowered through it. You do feel like you're in kind of control of your destiny through your healthcare journey, and kind of have what you need to give yourself kind of the best that you can do to get to the best clinical outcomes.
Yeah, I think that deeply resonates with me because my experience is I find different providers maybe through like ZocDoc or some search process,
Mhm.
and then you're kind of married to that provider, not knowing if that provider's the right fit for you really long term because you haven't had a chance to evaluate and do all that research on the different providers, and then you're not even sure all the things that you personally should go through to deliver best outcomes for yourself, because you're basically getting the generic recipe or playbook. And so it's super not optimized, surprisingly enough, and that feels frustrating, right? And I think there's a knowledge gap between patients and what care they ought to get. And it's because providers have a limited amount of time, right? So
Mhm.
someone like, and by someone I mean it's technology that is able to bridge that gap, matching patients with providers, and also addressing some of the knowledge gap there,
Mhm.
knowing like what you should do as you get older and things that you should be aware of, tests that you should go through. I think awareness is critical, right? And I think the more we also have devices like IoT devices that we have on ourselves, that could be another great data source, right?
Absolutely.
Which should be leveraged as well.
Absolutely. That's another area where I think I'm really excited about this space growing, which is the ability to turn medicine from kind of very discrete, separate appointments with the healthcare system to much more of a continuous system where there's some digital capability where a member can constantly be entering, here are my symptoms, this is how I'm feeling today, here are some results of any at-home monitoring that I'm doing, and there can be a much more real-time interaction of kind of alerting to the healthcare
Hmm.
professionals and them kind of monitoring your results over time. They can much more immediately determine if something is off, much more immediately get on a call with you if they need to intervene or talk to you in some way or bring you into an appointment. And it will flip the way medicine is delivered from
Yeah.
kind of, again, this kind of very cold type of discrete feel to kind of this provider is here for me all the time.
Hmm. And I think all of this makes sense for delivering better patient care. There are areas of healthcare which also affect the healthcare system at large, and that is largely administrative, right? So, and we see this firsthand. It's like the middle and back office functions that support the healthcare system. They exist, and they exist for a reason, but they are overburdened by um, a lot of work, and this comes down to things like um, clinical decision support, to make sure that there are no issues with the prescriptions and such that are being assigned, reimbursement processing, prior authorization, getting approvals for certain things you may need on the healthcare side. And it seems like a lot of these functions, they're still being done by a lot of people reading through documents, maybe querying
Sure.
data from databases, and like outsider looking into the healthcare system, there's great technology which can help address some of this. Some of
Mhm.
it's Gen AI, some of it, is maybe traditional classical AI. Some of it's just better data engineering, so the pipes kind of flow through. I'm curious what you've seen that is starting to happen in the administrative side of things, because that adds to the overall cost of the healthcare system, right? So ultimately, it makes the
Absolutely.
patient's cost much more expensive than it should be.
Mhm. Absolutely. Maybe I'll give you a couple of examples. Already, we're seeing kind of that administrative and logistical side of healthcare kind of almost being the first to be able to be inflected by the recent advances in Gen AI. For example, there are a lot of basic questions that members have. Is this covered or is this not covered? How much
Mhm.
am I going to have to pay? Where am I in my deductible, et cetera? Um, that nature of question, or at least some subslice of it that doesn't have much additional complexity, can easily be answered kind of with the right training of plan details into a model. And so, kind of the promise of being able to kind of more automatically answer that first tier of questions for a member, such that they're not on hold waiting for someone to answer for an hour to
Uh-huh.
get the answer to something very simple, is going to make a huge change, both for kind of the capacity within the system as well as the experience for the member. Second, as we've mentioned before, healthcare is a very information rich field, right? The amount of information a care professional needs to help someone get through the system, the amount of information a clinician needs to stay fresh on in terms of medical literature and the kind of the
Mhm.
nuances of their specialization, it's a lot. And so there's a promise around kind of how we can take complex knowledge bases and kind of condense that into kind of here is information that I need at at my fingertips, easy to
Yeah.
query, easy to ask, get the responses back and forth in kind of very understandable manner very quickly, that will not only accelerate the pace of delivering medicine, but I think improve the quality and the safety of medicine as well. And then lastly, after you have every interaction, there's also the context of that interaction, right? The notes that providers and
Mhm.
care professionals are taking that are so important to make sure that the right follow-ups that are happening and nothing gets lost in the cracks. That last piece is also something where we're seeing, auto summarization tooling come into play to really kind of reduce time off of those steps, but also the quality of and the kind of the
Mhm.
detailness of that documentation and the ability to use it for continued interactions.
Yeah, it's very interesting. I mean, generative AI allows you to access information that is stored in the form of unstructured documents. Let's say it could be semi-structured documents, as well as databases. Right, they're querying products that you can query databases and retrieve information, and a lot of that querying of intelligence is the administrative cost in healthcare, where you're trying to figure out simple things like, is this covered or not covered? What is your deductible for in network or out of network or particular type of
Mhm.
specialist? You have that is available. Like, you go on your Aetna or whatever insurance provider you have,
Mhm.
but then you need to read through the document, and the document's very lengthy, and even the condensed view might not really give you the. It's just hard to retrieve information, right? And it should be as simple as you put a. Go ahead.
Oh, it's hard to understand. And even
Mhm.
if you get to a conclusion, you find yourself questioning, did I interpret this correctly? Is this actually
Yeah,
right?
yeah.
And the impact on the other end is high, right? Because you're nervous
Mhm.
about getting stuck with a bill that you don't anticipate.
That's right. That's right. And you have uncertainty around that coverage. And sometimes you don't have time to wait for that clarity to come about. So you're like hoping for the best, and you get a procedure done. And then sometimes it's as simple as, like, finding the right charts and data. Like, what did you do a lipid test? What were your lipid test results from the last, like, 3 years or 4 years? Right. If you have that data stored, and then you query against it, and maybe even visualize it through just a simple interface. I think one thing that I've seen is, like, ChatGPT. Um, Obviously the model is really great, but I think the innovation also comes on the user experience that they helped introduce, which is it's now easy to, like, quote unquote, access AI, and take that same capability and now hook it up to your internal data, so data about yourself, about your insurance provider, about all the diagnoses and work that you've done with your healthcare providers at large. That can power wholly new experiences that are like ChatGPT like conversational experiences, but grounded by exactly your data, right? And I think that is as low hanging fruit, help reduce some of the administrative costs that I'm sure exists because of that.
Mhm. Absolutely.
And then, I guess, turning a little bit, and I think, obviously the healthcare system um, has many challenges and challenges that they're overcoming. Are there lessons of things that have gone really well in the healthcare system that others in the regulated industries, let's say insurance or banking or others, could learn from the healthcare experience?
That's a great question, and I think a rare one because usually the impression is that healthcare is behind. Um, I think one of the things that comes out multifold when you're starting with a healthcare point of view is the importance of the member. And so the
Mhm.
extension to other industries is that user focus, right? There's a heart that comes along with healthcare innovation, where at the end of the day, kind of the considerations that you have around, what you can automate or how high your bar around accuracy is, or kind of where the human really needs to stay in the loop. It really comes
Mhm.
from this place of always do what's best for the member. At the end of the day, the goal here is to make sure that they are getting to the best possible care and the care that they deserve. Um,
Mhm.
and you see the innovation kind of form around that in a really kind of heartwarming way.
Yeah.
And I've kind of loved working with kind of our product and design counterparts at Included Health because that is the mindset that they really bring to the table. And so kind of that would maybe be my advice for other industries, that kind of always start with that end user in mind, no matter what you're building or what you're innovating around.
Yeah. I love that because that clarity is there in healthcare, right? That you're doing what is best for the patient or should be, right? And that's generally the stance of even providers and others in the space. And I think that clarity should exist in banking, for example. And sometimes it does, sometimes it doesn't. But for a mortgage applicant that is filing an application, and a lot of people think about Gen AI as like reducing costs, reducing the burden for internal employees and such. But ultimately, the holy grail is that the mortgage applicant has a beautiful experience. They get a decision faster. They're able to see more quotes in a reasonable amount of time, so they could go in and have a very competitive uh, bid for whatever that they're looking to do, right? And that's true in mortgage lending. It's true in account opening. Like it should just be as it should be as frictionless as possible so the user has a beautiful experience. Insurance is the same thing. It's like in insurance, um, when you file a claim, you want to make sure that the person that needs the disbursement of funds to go and like pay for repairs to the home or their auto loan, or obviously in a more dire scenario like for a lost one, they want access to the funds in a readily available time frame, right? And I think keeping that in mind and to drive better outcomes, I think that clarity, I think, is absolutely right. That comes from healthcare. I think it's something that insurance and banking should wholesale adopt.
Absolutely.
Yeah. So I guess maybe a final question here, and it's a little bit tricky, but and obviously as AI becomes more prevalent in healthcare, there are concerns around job displacement and the changing role of healthcare professionals. How do you see AI augmenting or supporting the work that clinicians are doing rather than replacing them entirely?
I don't see AI replacing clinicians. I see AI empowering clinicians. And even kind of to go more specific, I actually think that healthcare has the opposite problem today. Today, we don't have enough physicians and clinicians and nurses and care professionals to address the needs of everyone in the United States. And there are definitely kind of pockets of the country and communities of within the country where access to care is super hard. And so instead, I kind of see AI as an opportunity to help bridge that gap, kind of kind of take the supply that we have today in the country and help it actually get to kind of everyone who is in need within the country. I think a lot of what we talked about today helps us get there. So if you can kind of in a much more kind of optimized way, figure out exactly which professional is right for a given member at a given point in time. It's also your mechanism to remove waste from the entire system and make
Mm-hmm.
sure just the right interactions are happening. That's a way that we can kind of scale the workforce within the United States. So I think we're really far from the hey, AI is taking over this field. I think we have a long ways to go where AI can help this field and really help improve the access of care in the United States.
Yeah, I mean, I completely agree. I think you're absolutely right. There are not enough clinicians given the amount of healthcare needs out there. And I think AI helps close some of that gap. The other thing that I constantly hear is clinicians don't want to be doing as much paperwork, as much administrative work as they are doing today. So they get to do what they were trained to do and what they love to do more than what they get to do today. So more volume of activity of the type that they enjoy, as opposed to the administrative and grunt work that a lot of clinical work could be, like taking notes and transcribing things that you've done, things like that.
It's more than, I mean, or in addition to the parts that they enjoy, it's also having them spend more time on the impactful part of their
Mhm.
job, right? More time actually having that clinical judgment and those important conversations with the patients.
Incredible. Well, it's been a pleasure having you on the podcast. Where can people find more about you and Included Health? We'll make sure to include that in the show notes.
Absolutely. You can find me on LinkedIn and you can learn more about Included Health on the Included Health website.
Perfect. Well, thanks for joining us on this podcast.
Yeah, thank you, Ankur. It was great meeting with you and getting to chat with you.